afternoon.
Can you please introduce yourself?
Okay, so my name is Henry Jones Murray. I'm a psychologist working at the Harmony Mental Illness Solutions.
We have heard that in Malawi there are a lot of suicide cases among men. Can you tell us some of the factors you think are contributing to the increase of this case in Malawi?
Okay, yeah, so suicide cases have really been on the rise in recent years. Yeah, especially we've seen the statistics. Yeah, recently we've seen the statistics from the Malawi Police Service that about 281 people have already committed suicide this year from January to June. Yeah, so about I think 246 out of those 281 are men. So you can see, of course, the numbers are actually growing. This is higher compared to, I think, the number of people who maybe within the same period who committed suicide last year. So there are so many factors that are contributing to that. Yeah, one of it being like the issues of mental health, because there's an established link, between mental health issues or mental health conditions and suicide rates or suicide ideation and suicide attempt. So basically there are so many factors like issues of mental health, especially depression, anxiety, substance use. These are also contributing a lot to suicide cases. Yeah, but also just general stressors that people experience, psychosocial stressors, breakup, relationships, breakups, issues of financial challenges as well. Yeah, but also just the other factors like issues of maybe divorce, whatever. All those things are also contributing to those cases.
Can you tell us how you think Soweto pressures is impacting more on what? On this suicide cases among men?
Societal pressure.
Yeah.
Yeah, so societal pressure is also one of the things that contributes, because so there's a lot of pressure, expectations from, let's say, society about, let's say, men, because I've seen the number is on the increase, especially on the side of men. So there are a lot of pressures for men to support, like to provide, for the families. So I've seen financially with the current economic situation, most people or men or like men are challenged. Maybe they can't provide, so they can't meet their obligations or the societal expectation that they're supposed to provide for their families. They're supposed to be the breadwinner. So lack of that can also contribute, because they feel like it affects their self-esteem since they can't be able to provide. So they feel like less important, less valued. So that can also lead to those negative thoughts, negative self-talk, and even suicidal ideation, suicidal thoughts. Yeah.
Okay. So what are some of the common mental health issues that men in Malawi are dealing with? And what could be the cause that is leading to suicide? Some of the mental health issues.
The common mental health disorders that most men experience, but it just applies to it's not about gender, but just the common ones, either men, women. So the most common ones are depression, anxiety, substance use disorders. Those are the most common ones. Yeah, so most people are dealing with these conditions, like mental health conditions. Yeah, so the causes could be many. You talked also about the causes. You asked about the causes. What could be the causes? Yeah, so the causes are many. The causes of mental health disorders are biopsychosocial. So the causes are biopsychosocial. The causes would be biological, psychological, sociological. Yeah, so there's no single cause for mental disorders or mental health problems, but the cause is interaction of different biological factors, psychological as well as social factors. Yeah, so for example, biological, somebody could be genetically predisposed to developing a mental health disorder. So for example, if they have a genetic predisposition, and then they're going through stress, chronic stress in their life that can just precipitate the, mental health problem, which they already have a genetic predisposition. Yeah, others might have like psychological causes or factors, could be lack of coping skills or poor coping skills, or just like issues of the different psychological issues that people experience. Could be low self-esteem, could be issues of coping with different stress, or maybe grief, issues of grief or loss, different kind of losses or grief that people experience, or could be psychological as well.
So how does gender play a role in how mental health issues are expressed and dealt with, particularly among men?
Yeah, so there are a lot of myths. That's a problem. There are a lot of myths and misconceptions that usually that affect how men, deal with their issues, mental health issues, emotional issues. Yeah, so because there's like a kind of like social myths about masculinity, because men, I think actually growing up, men are actually taught to be strong. They have to be like, the cowboys don't cry kind of attitude, so that actually impact how they express. So it impedes healthy coping, instead of them to cope or to express their emotions. So they tend to repress their emotions instead of expressing their emotions. They repress because casually they might be viewed or as weak, if they share how they feel, if they complain, if they seek help, if they, so if they just, show like emotions that they have and all that. So that's a challenge. That's how I think culture also contribute to that.
Could issues like unemployment, substance abuse, or family pressures be linked to the increase of suicide cases among men?
Yeah, they can. Like I said, psychological factor I mentioned about lack of like poor coping skills. So, for example, if people go through those stressors in life, like unemployment, so if somebody don't have like healthy coping skills, going through such stress like loss of the job, unemployment, or things of like societal pressure, they can actually put them in a lot of like pressure, and they may unable to cope or deal with that in a healthy way. They may actually start thinking negative about themselves and triggering like irrational thoughts like suicidal ideations and all that. So it does, but it depends on the like how people interpret, how people cope, how people deal with that. But it's not just the lack of or like unemployment that directly leads to that, but it's how maybe someone deals with that. So there could be people who deal with that in a healthy way, without actually thinking about suicide or triggering suicidal thoughts. So it's not just what happens. That's another thing. It's not just what happens to people that influences how we feel, how we act, or how we behave, but it's how we interpret. So because of maybe negative interpretations, appraisal about those events or situations, like you are unemployed, you may start interpreting that in a negative way and irrational thinking, like maybe you're not worthy, you're not good enough, you're not important, and all that, because you don't have a job or because you have lost a job. So that then can contribute to those negative thoughts. But if people have healthy coping strategies, such kind of stressors might not really trigger suicidal thoughts or ideations, but because of lack of healthy coping skills.
In your experience with the culture of Malawi, how do you think Malawian culture norms around masculinity and manhood affect men's willingness to seek help from mental health issues?
Yeah, so like our cultural upbringing was like from early, like socialization. As we grow, we are socialized in different norms, cultures, whatever. So I think that's a problem, because when we're growing up, we are socialized like, okay, men are supposed to be strong, they're supposed to deal with issues on their own, they're not supposed to seek help, they're not supposed to show like the emotions and all that. So that contributes a lot because men, when they struggle, they are not open, to seek help or to talk about their issues, and then that can affect, because they may not be able to get the help that they need because they're not opening up, they're not able to share, they're not able to go and seek help. So that's a problem. So sometimes they may want to do things on their own. It's okay, I'll deal with it. I'm a man. I'm going to manage this. I'm going to handle this on my own. So without sharing with others, and then may find that the problems may be, worsening. They may actually develop those kind of maybe suicidal thoughts because they were not open enough in the first place to seek help or to talk or share with friends, people that they trust. So that can affect mental health in that way because basically they will have a lot of stress to deal with issues on their own.
So, how do you think modern social changes such as economic pressures or gender shifting roles are affecting young men's mental health in Malawi?
Economic changes. So it goes back to what you said, because economically things are difficult, so it's difficult for people to make ends meet, especially men who are charged with that responsibility. So if they can't provide for their families, they can't provide for themselves enough, and then that affects, their self-esteem. It affects how they look at themselves, how they view themselves, things like that. So, but also currently I think it's issues of individualism. So it's like now we are actually becoming more kind of individualistic kind of a culture. We are moving away from a collectivism kind of a culture as a society. So it means now if you have issues, you have to deal with them, on your own. Unlike in the past where there was more kind of a communal, kind of collectivist kind of life or culture, where you actually rely on others, the extended family systems, and all that. But now, those kind of, systems have been, they are no longer there. So it's just, more kind of individualistic. So therefore it puts a lot of pressure. If you have challenges, you can get help from, let's say, your extended family, because everyone feels like, okay, they are responsible for their own family and all that, for themselves, for their own family. So it becomes very hard because, unlike in the past where maybe you don't have food, you'd go to the village, others will still give you, still be able to eat, even if you don't have food in your house, but you would still be able to eat from the, the community would actually come together, they share and all that. But that kind of umuntu, that kind of kind of culture is gone. So then if you don't have, it means you don't have, then it puts out of stress and pressure.
It's true, it's no longer there.
Sure.
Nobody is willing to help the other person. Everyone is facing their own problems on their own.
So there are no any solutions that can come in to those that maybe need solutions from other people that they can't think for themselves anymore. Do you think there can be any solutions with the changes of culture?
Culture, to do with culture. Of course, because culture, when you look at culture is something that is dynamic. Of course, it's not static. Culture is dynamic. So what was acceptable yesterday might be unacceptable today or tomorrow. So similarly, as we go, it's possible, but still more, that means we have to change in terms of changes have to happen at different levels. For example, changes maybe at family level, starting from there, socialization, parenting, at the community level, and then the different systems, the schools, all these are different agents of socialization that take part in terms of socializing individuals in society, impacting the values, beliefs, and all that. So it means there have to be changes at all those levels where people need to start now embracing more of, those values, those beliefs, of umuntu, things like that. But it's something that, is actually, yes, possible. You can still be able to, bring back those kind of values, that we had, but starting from that level, like different levels, like I said, maybe at family, school, church, they all have to play a role in terms of encouraging people to, be,
More flexible.
be more, available, be there for each other, being actually, that's important.
Okay, so with some of the advancements of technology that are coming in Malawi, how do you see the role of social media in shaping the mental health of young men in Malawi? And how is it contributing to the increase of suicide cases?
Okay, I think it says specifically in Malawi, because there's never been, I think, a study that has been done specifically maybe in Malawi to understand the issues of mental health and social media or technology and all that. I think, but then there are different other studies, so the different evidence from different studies. So social media is good, so it has a positive aspect of it, because it also helps people who are socially marginalized to, connect, to be able to, interact with others, share, whatever, But then on the other hand, it can also impact negatively on the mental health of the young, maybe people or adolescents. Yeah, because there's a lot of stuff that happens on social media. Maybe there's a lot of cyberbullying also. So that can also impact the self-esteem of some, young people. Because of that, sometimes, let's say you post something and then you see maybe the lifestyle of others, like, okay, you look at your colleagues, because maybe you may not know what exactly is going on in the life of other people. You may just be comparing yourself with other people, think like maybe others are enjoying life, others are doing much better than you are. So you may be thinking like, okay, my friends are doing better, because you see the, what they post. Which may not be a true reflection of maybe whatever, life they're going through or they're living. So sometimes maybe that kind of comparisons where you look at yourself and say, but I think my friends are this, okay, the way they dress, their lifestyle, whatever. So, and then that can impact on the other adolescents or other young people negatively, They may start actually feeling like maybe they are not really, like they are failures, or they are not successful in life, or they are not really doing, better. Others are doing much better than them. Others might also, let's say, maybe you post something, for example, you may feel like maybe you don't really get enough likes, enough what, and then sometimes those kind of things might actually reflect. Others might, it might actually reflect on their self-esteem, like feel like, okay, maybe people don't like me.
Maybe I'm not enough.
I'm not enough, or whatever. Maybe I'm not, attractive. I'm what? Because maybe of the comments that you get, or maybe the likes. You feel like, oh, you don't get enough likes, don't get enough comments, and all that. Positive feedback, the way you expect. So they might be, measuring their self-worth based on the comments they get, the likes they get on social media. So, okay, I'm worthy. Oh, because I get so much likes and all, I didn't get much comments and like. So then that can sometimes lead to mental health issues, like maybe depression for others, and they can also trigger suicidal ideations and attempt for other people.
So, do you think there are any patterns that the youth can engage in when they're using social media or online platforms that can help them to feel a little bit, to relieve their stress? Any patterns? Or how can they use social media to remove their stress? Let's say it like that.
Yeah, so, of course they need to, maybe it's important maybe to, educate them to say, okay, maybe there are things that they cannot control, and there are things that they can control. So there are things that are within their control, some things that are outside of their control. So for example, the reactions of other people, on social media or whatever, you cannot control that. You have no control over that. What people say about you, about what you post, about, that is outside of your control as a person. But maybe they need to be aware of what they post, I think because that is within their control, what they choose to post. But also just being more of
accepting what you are.
It's
also a good way of
Dealing
going
with
through this.
Exactly. Accepting that, self-acceptance, being able to realize their own worth, that they are worthy the way they are as individuals, regardless of whatever happens, I think things like that. So maybe what they post, they can control in terms of what I think maybe what they are posting. So I think that would be maybe what I would think about that.
So by the term stigma, how do you think, or how does the stigma surrounding mental illness in Malawi affect men's willingness to talk about or seek help for the problems?
So stigma contributes a lot to, maybe like lack of, people like seeking help. Most people don't seek help. Most people don't really, get or go and seek help that they need because of the stigma. They feel that, okay, I'll be labeled this or what. So it's like the stigma is too high in our society. Much as the issues of mental health are now, getting more attention, but there's still a lot of stigma. So because people feel like, so there's a lot of also a lot of myths and misconceptions as well about mental health, mental health issues. Because sometimes when people think like, okay, if you have a mental health problem, others think like, okay, maybe you have, you are substance abuse, it means okay, or you are sick. All people also think like mental health is just about the serious mental health conditions, like maybe schizophrenia, where people have, lost touch with, complete touch with reality. So they don't understand that there are different maybe types, of mental health disorders, mental health conditions, and that people also have different symptoms. But so some people think like mental health as if it's just one thing, like mental health, it means, or maybe someone who is, walking in the streets naked, someone who is just, complete, has lost touch, somebody who has hallucinations, delusions, and all that. But people, might be impacted at different levels. So it's like you look at it from a continuum, because others might be having severe mental health disorders, others might be having, like mild, in terms of severity, moderate, severe, and all that. So there's some others more serious mental. So that is another, I think, the stigma. People think like, it means maybe if you talk about mental health, they associate others with, okay, maybe drug or substance abuse. So okay, maybe he was using cannabis, maybe I was abusing this type of drug. But also just the kind of, because we have not really accepted that mental health is just like any other disease. Like people can have physical problems, physical conditions, medical conditions. But people think like, because maybe of our beliefs, with also witchcraft issues as well, so people start maybe thinking like, maybe you've been bewitched or what. So that can also affect people in terms of seeking early treatment or intervention, because people, if they believe like, maybe it's witchcraft, then they will delay seeking help. They will go to the witch doctors, whatever, instead of going to, the hospital where they can mental health, maybe clinic or hospital where they can access help. So they'll just be thinking like, okay, it's a casual thing, it's a witchcraft and all that. So that thing can also contribute.
Okay. So what are some of the ways to reduce the stigma around mental health so that men can feel more comfortable and start seeking for help?
I think the main one is just raising awareness. So that most people become more, more knowledgeable about mental health issues. But like I said, it comes in as a result of maybe ignorance. Most people don't know much about mental health. So we need to raise a lot of awareness, awareness at different levels, so awareness, like, in schools, awareness in church as well, because sometimes the church might just spiritualize everything, so these are like demons and all that, but then, so raising awareness even in the communities, in the families, whatever, to say this, mental health is something that is real, something that can affect anyone, so no one is immune from mental health conditions, because mental health issues affect people from all walks of life. So we need to raise that awareness to say everyone, can actually suffer from a mental health issue, mental health problem. So there's nothing to be ashamed about. There's nothing to to feel bad about it. So it's and there's nothing wrong. It's not somebody's fault if they develop a mental health problem. It's not always their fault. But sometimes it could be something that is outside of their control. Like we said, others might develop, or they may have like a genetic kind of link. Maybe you inherit it from your family, and then as you grow, you meet some stressors, and then you develop an episode of a mental health problem. So just raising awareness would be, I think, most important. At different levels, awareness, that people become aware. They know that, okay, if you have a problem, whether you're a man, whether you're a woman, or young, old, whatever, so everyone should just be able to say, okay, if they have a problem, they can go and seek help. It's just okay. It's just normal.
I feel like in the communities, we should also engage in making campaigns against discrimination, because I feel like discrimination is also another factor that's causing mental issues in the societies.
Exactly. So that's important, really, to have campaigns to talk about it, encourage people to talk about it, look at it, change their perception about mental health.
Okay. So what are some of the strategies or interventions you would recommend to address the rising suicide rates among men in Malawi?
So there will be different interventions that I would suggest. For example, maybe first to be, let's say, at policy level. For example, because I think there's been a lot. I think mental health has been a neglected, kind of like area. I think if you look at the national, like the national budget, there's a very little, that is allocated, little resources are allocated towards mental health. And you can also see that, we don't have enough mental health facilities that are public mental health facilities where people can go, but we have so many, clinics that just focus on medical. So our focus has been a lot on medical model of care, not on, maybe focusing also on the psychological, aspect of it. So even you look at the institution, like I said, very few public facilities where people can access help. So I think maybe it start from there. I said they should be able to allocate enough resources, maybe have enough structures. Mental health institutions where people can actually go seek help. But also in the hospital, I think there is a problem because most people go to these like public, the general hospitals. They go to general hospitals when they're feeling, unwell, they're feeling a headache, they're feeling what. So most of these mental health conditions, which like trigger, like I said, most of these suicidal thoughts are also triggered by mental health, underlying mental health issues. So you find that people, they would go to a general hospital, they go to the clinic, they're feeling, some, pain, whatever, headache, whatever they're feeling, and then they might be also having underlying, mental health issues which might present in a physical form. For example, somebody would say, okay, I have problems with sleep, issues of appetite, they may think it's malaria, they would do all the tests, find maybe there's nothing, or headache, maybe it's just issue of stress, anxiety, and all that might trigger those things. And then those people would go, but they have underlying mental health issues. They have stress, the issues that are affecting them, issues that are affecting the way they think, the way they feel, the way they behave. But they are not, identified because they are not screened. So I think maybe it will be important. Maybe if we can have like, those kind of intervention where people have to be screened when they go to the, clinic, because some studies have shown that a good number of people who commit suicide, they have had a contact with a health worker, maybe in the past, let's say past 3 months, past 5 months. But they had already those suicidal thoughts, but because they were not assessed, they were not screened. So they would go there and meet the doctor, the clinician would just treat them for whatever they are, physical problem they are presenting. Okay, I'm feeling a headache, I'm feeling what, but they are also having psychological issues. So to just treat them the physical aspect of it. Okay, get Panadol or whatever, and then you go. Next time they come back again, headache, or maybe diarrhea, which might also be triggered by other, stress and all that. So because those services are not provided in general hospitals, they are not provided where most people go, because, like I said, it's a low awareness. Very few people would realize that, okay, the way I'm feeling, maybe I need to go and see a mental health professional, and the services are not also easily accessible and all that. So it means where they go, where most people go in general public hospitals, I think if they can be screening, so they can be able to pick out or identify those that are suicidal, they can be identified earlier before, and then they can be appropriately referred, they can be referred. It's okay, we have noted that maybe you're having some suicidal thoughts, or maybe some kind of depression, some basic screening that they can be doing maybe at the OPD when people go for like consultation in the general hospitals. That would also help reduce maybe the number of suicide rates, because most people would be identify those that are suicidal, but because we don't do that assessment, they don't just focus on the presenting issues which are mainly physical in nature, medical, but they might be also mimicking some psychological mental health problems. So we miss people in that way, people that would have been identified and then referred to appropriate maybe mental health professional to support them. So that would be another thing, maybe having screening but also just encouraging people to connect socially, just connecting socially, because that also helps so much, having those kind of relationships, in person kind of contact, where you have like kind of social support. It also offers like that kind of social support, like a buffer when you're going through stress. So it would be important to have those meaningful kind of relationships to avoid isolation. So I think that would be important. But also, just encouraging people to talk when they're going through issues. Talking about, they say, problem shared is half solved. So if you share, your stresses, your pain, the emotional pain that you're going through, you share with people that you trust, people that you feel they can be able to listen to you without judging you. People who can be, there to offer that empathy, that kind of active listening, and just being there for you to share and vent, your emotions. That would also be good.
All right. What role can schools, workplaces, and other institutions play in improving mental health among men in Malawi? More especially young men.
So in the workplace, I think it would be important maybe to also develop specific interventions that would help to promote mental health. So for example, maybe workplaces need to be more kind of
providing fair treatment to all the workers.
Of course, because there's also a lot of bullying that also happens in the workplace as well, both in school, even in the workplaces. So there are a lot of, people who actually experience that bullying as well. So improving the work environment would be, I think, important. So I think helping people to have more control on their job, but also just providing opportunities for people to, like, also have access to these services. So there are some places or workplaces, some organizations which provide what we call like employee assistance, employee assistance programs like mental health assistance, where people who have issues, employees, they are, supported, they will go seek help, and then the employer will take care of whatever cost that will be incurrent over that, so that will be more important. But also just promoting like physical activity as well, you know, in the workplace. So trying to reduce sedentary time and trying employees to be more active, you know, in terms of also designing their job kind of work conditions. Yeah, so people have to be more active, because inactivity can also contribute to a lot of mental health issues as well, even at the workplace where most people spend much of their time, you know, because people spend much time at work, you know, so than in other maybe places as well. Yeah, so that kind of, yeah, also just appreciating employees, you know, encouraging them, rewarding them, being fair in terms of how they reward them. I think that will also be important. It also helps to boost their safety, boost some employees who feel like they are left out because maybe they are putting in much effort, working hard, but they are not recognized, they are not appreciated, rewarded, and that can demotivate them and can actually affect their morale and their self-esteem as well. So that stress can actually trigger also some mental health issues. Yeah, so I think that would be some. So in terms of the school context, yeah, just also making sure that maybe schools should also have like spaces where children, because most of our schools, they don't have like counseling centers, you know, so that's another problem, because children also experience a lot of stressors in their life, you know, both within the school environment, but also some that maybe also from their homes as well. They may have
especially
issues
from the families.
Yeah, so they come to school with their own personal stressors, and then the school environment will also create some, you know, also, but then they have nowhere where they can go, because teachers are not trained professionals to handle these issues. Yeah, so, but we don't have those services in Malawi. So I think it would be important to make sure that we also have counseling services, you know, offered to students, where you need to have counselors in schools. Students can go and then they'll be looking at the psychological aspect of the students, the learners, and the like. Yeah, then that can help to promote mental health, because yeah, they will be also try to be like mentored, or like in terms of maybe resilience, how they can deal or cope with different issues, stressors, so that they should have that, you know, resilience as they grow, to say how can they face adversities, how can they deal with the stressors, challenging situations in a healthy way. Yeah, so that can be some kind of intervention that will be offered and would act as a preventative kind of approach. Yeah.
Are there any programs or models from other countries that could be effective in addressing this issue in Malawi?
The suicide issue of society.
Yes.
You're talking about the suicide.
Yeah.
Of course, basically, yeah, because of course I think we have some helplines, suicide, but I think maybe it's not, but I don't think they're not by, you know, but maybe there is not much awareness about that. So I think it would be important like to have like helplines, suicide helplines, where people can call when they are suicidal, you know, when they are going through issues and then they are contemplating, you know, ending their life or suicide. So people can call like a helpline, a toll-free line, where they can always reach out anytime, you know, because that would also offer like kind of like a privacy, you know, they can call, they know their identities will not be, but they will just get the help they need. So that would be one thing, I think, they maybe having those kind of helplines. But also one other component would be, like you said, trying to mainstream mental health in our health system, mental health issues in our health system. Yeah, so for example, I think in other countries what happens is like when you go to a clinic, like I said, you're all supposed to have, at each and every clinic, you know, you're supposed to have mental health professionals there. You're supposed to have counselors there, you know, who are there to just help people deal with the, you know, the mental health issues. Yeah, so that also helps at each and every facility. So people can be, you know, helped to deal with their stressors, deal with their emotional issues and all that. And then that can help reduce the case of suicide. Because like I said, people would go and just meet a clinician who's just focusing on the medical aspect of care, and then they just deal with the medication and all that. But then people would want someone who can just listen to them, try to help them deal with challenging situations, how to navigate challenges in their life and all that. So if we can have those kind of, like in our health care system, having like at different levels, starting from a health center, you have counselors there, district hospitals, we have psychologists, central hospitals, because for example, you go in our central hospital, you find there are no, psychologists, and there are very few psychologists currently in Malawi. So maybe a lot of training as well, training for a lot of mental health workers, maybe psychologists, counselors, but also employing them so that they can be able to, provide the most, needed kind of support in healthy facilities. So let's say before a client goes to see the clinician at a health center, they would first of all maybe go and see the counselor assess them and see, okay, if there are issues and there are no psychological issues, then they will refer them to the clinician to focus on the medical aspect of it. The same thing if the client goes to the clinician. If they rule out any medical basis of whatever, maybe issues they're dealing with, then they will refer them to that. But that is not there, so it's a challenge.
What do you think the long-term effects of this trend will be on Malawi society if not the cases that addressed?
So it means the impact, the long term would be like to the society as well. It means the achievement of the the vision of Malawi, the vision, the agenda 2063 can only be achieved, because it's only mentally healthy people who can actively contribute to the development of their society, of their nations, their country and all that. So if we don't have a society that is mentally healthy and all that, then that means, it will have an impact on the economic development of the country. So there will also be a lot of loss, the cost, the cost in terms of government spending a lot of money, because it's very expensive to treat. As you know, they say treatment is better. I mean, prevention is better than cure. So if we don't work on this, like preventing all these kind of mental health issues, suicide and all that, we focus on the treatment. When people, let's say, have a full-blown, maybe mental health issue, trying to treat that would be very expensive, rather than preventing the occurrence of those kind of mental health issues would be cheaper or easier, more economical that way. So it means government is also going to spend a lot of resources on that, that would have been used for other more equally maybe important other development or priorities and all that will go into this. So it means there will be that kind of a loss. But also it also means that so the more we have these cases of suicide, it means so the development will be affected, will be retarded. It's going to retard or impede the development.
Very true.
Sure.
What advice would you give to young men who may be struggling with their mental health or feeling helpless?
So, advice I would say they need just to acknowledge whatever they're feeling, that it's normal. It's normal to struggle. It's normal to feel, maybe the way they're feeling and all that. So, that I think is important to realize that it's normal to feel all those negative emotions, the distress that they're going through. It's normal. Human beings sometimes, we struggle, we go through those kind of difficulties. But what would be most important is they need to reach out, for help, reach out for help. So that would be, I think, one important thing, that they need to seek help, seek professional help. But also just, help from different people, not just they can seek help from people they trust, or from the maybe church as well, friends who or just other adults, or friends, family, who can be there for them, who can actually support them, understand them, without people can validate their feelings, their emotions, just to validate them and listen to them. So that's the thing. They don't need to feel ashamed, but they just need to, seek help, and then they can be able to deal with their issues, and feel better, become productive again, deal with their stressors and everything, because it is possible. So sometimes if you have those kind of stress and you have negative thoughts, you feel like, okay, maybe you're never going to be happy again, you're never going to be okay, you're never going to be successful, or you'll never be able to enjoy it. So because when you're going through those, like, these people start overthinking, having a lot of negative thoughts, and then it affects the way they feel again, and the way they behave, or the way they act. But when they seek help, I think it will help them to change maybe their perspective about life, about their situations and the like, so they can start looking at it from a more positive lane, rather than from a negative.
So what should the society be doing to help men feel more comfortable seeking mental health support?
I think society needs to start normalizing. You need to have like more discussions, more conversations about mental health. So we need to destigmatize, I think, talking about this, and then trying to normalize, normalizing mental health, having these conversations at different forums, spaces, so that people can actually see that this is just like any other issue, just like physical problems, just like having malaria, just like having a medical health problem. So it's similar, the same thing. When people have malaria, we don't question them, we don't judge them, and all that, to say, why you have cancer, or you have maybe the different kind of conditions. We don't medical conditions. We don't judge them. We don't stigmatize them. We just say it's maybe it's okay. So we just show a lot of compassion. So similarly, we need to start like normalizing that, and then encouraging those conversations. So it is okay. It can happen to anyone. It's okay, but there's help available. It doesn't mean that if you have a mental health issue or a disorder, then you cannot be productive. No, it's not the case. You can get treatment, and you overcome that problem, mental health issue, or be able to learn how to manage it, and be productive again to your family, to society as well. So just encouraging those kind of conversations at different levels in the villages, in the communities, in the churches, talking about it, encouraging people to seek help, showing more compassion towards those that are already also struggling with the mental issues, because removing those kind of judgmental attitudes, but being more compassionate,
And also removing the perception of our ngozelezeka chabe.
So those kind of misperceptions and myths, like, they might prevent people from opening up, seeing help, like, people judge me, so that's being judgmental, so those kind of judgmental.
Ndikauzanzanga ingalula paeya.
So thinking like, things will be, it will go viral. So that's why we encourage people to say, okay, you seek help, or you talk to someone, you share with someone that you trust, someone that you feel like is going to, keep
the secret,
confidential, whatever you share. But even if somebody shares, it's also important to understand that you don't have control over the behavior of other people. Even you can't control the behavior of your best friend as well. So
very true.
whatever you share with other people, you have no control what they do with that. So you can be confiding in your best friend. It's okay, I'm sharing this, but then you may find your best friend is also sharing that with other people. You have no control. You can't control the behavior of other people. But what is most important, that should not prevent us from opening up, from sharing, because what is good is, just the act of sharing or talking about it in itself is cathartic, it's therapeutic. It also helps in terms of dealing with these emotional issues or mental health issues. So talking is good for mental health. You know, it's just good. Just talking about it is good for mental health.